Hi, everybody. My name is Dr. Andrea Ryan, and I'm here with Dr. Mykietiuk. And today, this is a brief introduction to the chiropractic lifestyle alongside the essential oil lifestyle. A little bit of background on myself. I am a family-focused chiropractor. I practice both in the United States and Canada. My husband and I owned and operated a practice in Barrie, Ontario, together for about 10 years, and at which point I sort of transferred out of chiropractic. So I'm no longer practicing, but my fellow chiropractor and essential oil educator, Megan, if you want to introduce yourself, you can tell a little bit about you.
Sure. Hey guys, thanks for joining us for this little intro today. So like Andrea said, I am also a pediatric and prenatal chiropractor located out here on the east coast of Canada. I've been in practice for over 12 years. I'm still practicing, but only in part-time capacity since I have 4 young children. I also practice with my husband, and together we have a great practice where we get to support families. But what we had found in our journey of working with a lot of families is that moms and dads have a lot of questions about what we were doing with our own family to stay healthy, and then what else we did when they were getting sick to actually support their bodies. And so beyond the stuff that they saw in the practice, one of the things that we did as well is use essential oils for a lot of years with our family. And that was something that I would talk about occasionally because it was a big support that we were using, but the time that I had with them just wasn't enough to educate them on what good oil use was, what safe oil use was, how to look for good essential oils that were pure. And so I started actually teaching classes to share that information, and people were so grateful because nowadays essential oils, they're everywhere. They're such a buzzword. They're at Walmart, Costco, Target, and they just didn't know, like, you know, do you buy online? Do you buy in stores? And then how do you use them? And so the classes became really, really important. And that really is what helped us to reach more people. No, not right now, but yes. And there's one of them right now. Yeah. The beautiful part about all of this is the flexibility to with lifestyle. But what we loved about sharing essential oils with families is that it really empowered them outside the 4 walls of our practice and beyond our 2 hands. And so the ripple effect of helping people really became so much more expansive than I ever thought that we would reach. And through that, my love of working with doTERRA and essential oils has really complemented my love of serving families in our community under our care. So what this college really intended to educate you about is how you can do that and how it can support you despite maybe limitations you might feel. You're already really busy, maybe you already have a busy family as well. You don't need another thing. We're going to talk about how simple it can be to add this into it because it really complements each other so well. And you can really get an appreciation for how incredibly supportive it can be for your life, your goals, more abundance in your life, and really having a greater influence in your community as well. So I think that just another reason to really tap into this is that 2020 has taught us a lot of lessons. But one of the big ones is that we shouldn't just rely on brick and mortar businesses anymore to support our families and create that security for ourselves, because what most of us saw throughout Canada and many parts of the world was that there was external factors that took us out of practice for a significant amount of time, or at least reduced our practices significantly. And that was a really scary position for a lot of people to be in. And I know I, for one, and Andrea for another, we were so grateful that we had started the process of building another online business years before we got to this point. And when we were essentially not making any money in practice, because my husband's also in practice, so that was gone, we had doTERRA, and that still was able to buy our family food and pay our bills and really support our life without having to go into a lot of debt or take away our savings. So 2020, that's what we learned. And so I think that this is why it's the perfect time to really explore this opportunity. The other fold of that is that right now, because of the closures and the quarantine and the lockdown, people realize that if they didn't have it within their home to support their body and their needs, whether it was physical or emotional well-being, they were at a bit of a loss. So all the people that we normally rely on to support us through, other health practices, natural healthcare practitioners, even our family doctors or pharmacists on the other end of things, that really wasn't a resource for a lot of people. And so more and more people were like, I need to bring those tools into my home to empower myself. And most people are interested in learning how to use them before they get back into an acute crisis mode. And now is the time to really do that. So it's really just, I think, the perfect timing to really help your community, but also benefit yourself. So with that, Andrea, I'll throw it back over to you.
Yeah, it's amazing to me how beautifully woven these essential oils have come into our life. Everything you've just described. when I was practicing and starting to build my doTERRA business, it was so easy. I mean, we are perfectly primed to be able to teach because we have a space that we can teach out of. And naturally, I feel like chiropractors are just really gifted to be able to educate and empower people on how to live a healthier lifestyle, whether it be through, very quick tips or suggestions or advice when they're in the adjusting room, or if it's in a class scenario where they're actually teaching to a number of people, very similar to how we would have a report of findings or like an intro to chiropractic class or something along those lines. So there are lots of opportunities that we have. And to your point, as you just described, we hope that we're executing everything we need to do to be able to support our immune system, support our stress levels. But what we did find, at least within our essential oil community, is that there were so many people who didn't quite understand the base knowledge of that. And so it was really lovely for me to be able to put the pieces of that puzzle together for them so that they felt a lot more empowered when it came to how to better take care of themselves. And I feel like that's been a general theme for the year too, right? Is that if we can't rely on, for example, a healthcare or a chiropractic office to be open, well, what can I do for myself at home? And what happens if I'm in pain, or if my kids get sick, or if our stress levels are going through the roof because one of us is out of work, or two of us are out of work, or we're all home, which you and I are doing anyways now. But we've got all of these pieces that play so wonderfully into it. To give a little bit of background on what brought me into oils, we had known about essential oils. We had tried using different essential oil brands in the past, but to be honest, we didn't have really great results with it. And then I was up at a family cottage, and my stepmom gave me a couple of samples of lavender and what is called Terra Shield from doTERRA, which is a bug spray. And it really helped us because I didn't have our all natural bug spray with us. And so it helps repel the bugs. And for those bites that we did have, we used the lavender. So that was my first foray into essential oils, specifically from doTERRA. And then it just grew from there. I mean, I got one bottle and wanted another one. And naturally, just like I would have taught in my class or in my office about maybe a little bit of nutrition or how to move properly or how to stretch, all of these different classes we were teaching, I just added an essential oils class to the roster of classes that we taught throughout the month. And from there, it kind of just naturally grew. We are very well positioned as chiropractors. We have great relationships in our community as healthcare practitioners, as natural healthcare practitioners. So I think it was a very logical relationship with the essential oils and chiropractic. A few years into it, I was at a CrossFit gym and injured my wrist. And this was about a year before I stepped back from practice, but I found I had tore some ligaments in my wrist. It made adjusting very difficult. It was my right wrist and I'm right-handed. So it just, even using an integrator was difficult for the first few weeks at least. And it just got to a point where my doTERRA business had gotten to a point where my income was pretty much matched as a chiropractor. And so I was able to transition out of chiropractic and keep up with doTERRA full time. It gave me a lot more flexibility to be at home and take care of our kids who were all in elementary school at the time as well. But I just had this passion that kind of overtook. Not that I ever completely stepped back from chiropractic. I still very much teach about it and make sure people are getting checked and we adjust our kids and everything. So that's obviously a huge part. But it was just, if I couldn't physically do it the way I wanted to do it, this was a great secondary option for me. Do you want to chat about what sort of brought you into it?
I think at the time, so with 4 young kids, it was a lot of back-to-back as far as pregnancy, nursing, and as most chiropractors do, my first 2 children, I took 6 weeks away from the practice afterwards. My third came along, I took 3 months away from the practice, and after my third, I was feeling really burnt out, I guess is a good way to put it, really depleted. And I felt like I was being drawn to do something else that could allow me to be more present for my family, but still connect to the community in the way that I wanted to do. And over again, doTERRA just kind of kept showing up. And it was actually a podcast where Andrea is being interviewed with another chiropractor, that it was like this light bulb moment of like, maybe I could make this work as a family chiropractor so I could still have the best of both worlds. And that's how we connected. And it's just been a beautiful journey ever since. And it allowed me so much that when I had my fourth child, I took 14 months off with him. And I felt just so much more present where I needed to be at that time without having the stress of losing that financial security of me being at work and my husband having to take that on instead. So it was just so meaningful at that time. And I wish that for everybody, because you shouldn't have to choose between one or the other. You know, you should get to have that time with your babies, and when you feel ready, be able to do something that you love again. But the beautiful thing was, even though I wasn't in practice for 14 months, I still continued to grow my doTERRA business throughout all of that. And again, almost matched my income there in both places. So it was really, really nice. Yeah.
Yeah, for sure. And just having that secondary option, and to bring it full circle back to what you described in the beginning, is that 2020 has shown us that we just can't solely rely on a brick and mortar or one stream of income, because we know that that stream can disappear like that, even if it's not necessarily a brick and mortar. In fact, to be totally honest, I remember March and April kind of being the holy smokes moments where things just, that shaky, that ground that was so stable before just felt incredibly shaky. And admittedly, those were probably two of my best months ever with my, I know in fact they were in my top 4 best months ever with doTERRA, or with my doTERRA business and my income. So it was just really felt great to have that in the background, knowing that that was going to continue to support us, whether it was our retirement or the current needs of our family at that time. So I wholly agree with everything you've just described. So Megan, you and I both said at the beginning of this call, normally what we do is about a 45-minute call with a number of different chiropractors on a monthly basis. And we wanted to just give you guys a taste of what this looked like. And I think we've done a good job of trying to keep it under 15 minutes, but there is so much more that we can go through and describe and share with you. So certainly this is our invitation to open it up and just invite you to our next chiropractic call. We do them monthly. If you're interested, we'll send you the date and time of our next one. Megan, can you think of anything else that you'd like to add?
No, I don't think so. You covered it all. I would just like to say that if you found this video in your lap and you're watching it for some reason, I would hope that you would come to the actual call with an open mind. There was certainly a point that I probably would have never thought if you had said to me, you will also do a network marketing business alongside your chiropractic business. Or I'm sure, Andrew, if somebody said you're going to leave practice and retire and do a network marketing business full time, that I would have ever actually thought that. But when you know the heart and the ethos of doTERRA and you really understand how much it aligns with it, I really feel like doTERRA does not take anything away from what I offer in practice or my passion about chiropractic or the profession of chiropractic and the legacy of it. But it enhances it and allows me to still show up as the best chiropractor possible when I am in the office, because I get to really just bring something extra as far as the knowledge and the opportunities to the people that I'm seeing. And it just enhances our lives in so many different ways. So just keep an open mind, because I think that, never say never. Again, another lesson from 2020, never say never. So
so true. And to close it off, if there's sort of one phrase that we talked about, is that it's, if we don't, a year from now, you're going to wish you started today. And the number of times that we've thought, oh, it would have been so great to have gotten started earlier, or in working with other chiropractors and other healthcare practitioners saying, I wish I started this 6 months ago when I first learned about it. So if you're interested, please join us on the next call, and we'll send you that time and date. Thank you so much, Megan. I appreciate it. All right. Thanks, guys.